IV line cannula overview. An IV line cannula, also known as an intravenous cannula or IV catheter, is a medical device used to deliver fluids, medications, or blood products directly into a patient's bloodstream. It is a flexible tube that is inserted into a vein, typically in the arm or hand, and secured in place with adhesive or a dressing. The IV line cannula consists of a sharp, beveled needle or a small, flexible plastic tube called a catheter. The needle or catheter is attached to a hub that allows for the connection of IV tubing, allowing fluids or medications to flow into the patient's bloodstream. Here are some key points about IV line cannulas. Insertion. The IV line cannula is inserted by a trained healthcare professional, such as a nurse or doctor. They clean the insertion site with an antiseptic solution and carefully insert the needle or catheter into a suitable vein. Once the needle or catheter is in the vein, the needle is removed, leaving the flexible catheter in place. Size. IV line cannulas come in various sizes or gauges, ranging from larger sizes, 14 or 16 gauge, to smaller sizes, 22 or 24 gauge. The choice of size depends on the purpose of the IV, the patient's condition, and the type of fluids or medications being administered. Site selection. The choice of the insertion site depends on factors such as the patient's condition, the duration of IV therapy, and the accessibility of suitable veins. Common insertion sites include the veins in the forearm, hand, or antecubital fossa, the inner side of the elbow. Securing the cannula. Once the cannula is inserted, it is secured in place using adhesive tape, a transparent dressing, or a specialized securement device. This helps to prevent accidental dislodgement or movement of the cannula. Monitoring and care. While the IV line cannula is in place, healthcare professionals regularly monitor the site for signs of complications, such as infection, infiltration, leakage of fluids into the surrounding tissue, or phlebitis, inflammation of the vein. They may also flush the cannula with saline or heparin solution to maintain patency when not in use. Removal. The IV line cannula is removed once it is no longer needed or if complications arise. Removal is typically quick and involves applying pressure to the insertion site after removal to